Hey everybody, welcome back to Drug Talk. This is episode 22. As always, I'm your host, Garrett Campbell. In this video, I'm going to try to go over some relevant information regarding testosterone taken in its oral form, so by its brand name, Andriol. So before we get started in this video, I should mention that there are many different forms of testosterone, and we'll cover some of the other forms in future videos. But in this video, we're just going to be talking about testosterone in its oral form. So testosterone is classified as an androgen. Basically, when you take Andriol, you are getting an oral bioavailable source of testosterone. And the specific version of testosterone that we're talking about here is known as testosterone undecanoate. This specific type of testosterone, unlike some of the other oral versions of testosterone, has the ability to bypass the liver via the lymphatic system, making it bypass the first pass metabolism and actually allowing it to be orally bioavailable. So oral testosterone is available as a 40 milligram capsule. It's indicated for testosterone replacement therapy in males who have conditions associated with a decrease or an absence of endogenous testosterones. So testosterone created by your body. Before the medication is prescribed to an individual, there are some precautions that the patient should be made aware of before starting on this medication. So patients who have clinical or demographic characteristics associated with groups that may have an increased risk of prostate cancer should be screened thoroughly for prostate cancer before starting testosterone. It should be noted that testosterone therapy has not been established to be safe or effective for athletic performance. And because of the potential risk of some serious adverse health effects, it should not be used for this purpose. If there hasn't been a clinical diagnosis of a deficiency in testosterone, then it shouldn't be used for the treatment of sexual dysfunction. It should be noted that especially in geriatric patients, so patients over the age of 65 years old, who use testosterone long term, there may be an increased risk of both breast cancer as well as prostate cancer. Testosterone does have the ability to raise blood pressure and can sometimes cause edema or fluid retention. Therefore, it should be used cautiously in individuals who have hypertension or high blood pressure, as well as edema. This is particularly important in individuals who have heart failure. It has been shown to alter glucose tolerance tests, so in individuals who are using this medication and have diabetes, they should be monitored more closely for fluctuations in their sugar readings. In terms of contraindications or reasons somebody would not be able to use testosterone, it can't be used in individuals who have a diagnosis or a suspected diagnosis of either breast or prostate cancer. Now, when somebody is prescribed this medication, in terms of dosing, we typically see 80 milligrams in the morning, followed by 40 milligrams in the afternoon. However, some individuals require 80 milligrams twice daily. Taking the medication after a meal was seen to greatly increase absorption. During the course of therapy, there are some monitoring parameters which are commonly used by physicians. Some of the things that they'll look to monitor are, oftentimes there'll be a broad clinical evaluation looking at the symptom relief as well as side effects, prostate assessment done at baseline or upon initiation of therapy, as well as annually. Some references recommend doing this prostate exam more frequently during the first year upon initiating therapy. A patient may expect to have blood work taken periodically while they're taking this medication to ensure that their liver function has not declined, as well as some other parameters that must be checked. In terms of a cardiovascular assessment, a lipid and triglyceride profile will sometimes be done, and physicians will often check for signs of edema or fluid retention. Check for weight gain, as well as any changes in your blood pressure. They'll also monitor for any sleep disturbances, as well as mood changes. Now, while somebody's using testosterone, there are some side effects that they may experience, so I'll share some of these side effects with you now. Some common side effects like nausea, vomiting, diarrhea, abdominal pain, or headache and dizziness have occurred. As I mentioned, some people do experience fluid retention. Personality disorders have occurred, such as confusion, aggression, depression, anxiety, and occasionally some cognitive disturbances. Some people experience a rash, others seem to develop acne, and there can also be some hair growth. I mentioned that there can be weight changes, as well as an increase in blood pressure. That's all I have to say about oral testosterone. As always, be sure to use this channel as a source of information and not a source of recommendations for your personal health care. If you have any questions regarding the medications that I cover, just direct them towards your personal healthcare provider. If you think I'm providing valuable information and you'd like to help see the channel grow, you can like the videos, share the videos, or subscribe to the YouTube channel. That's it for today. Take care.